Health Break is sponsored by Mission Health.
A hernia is a hole in the abdominal wall, often causing pain and a visible bulge. Dr. Sean O'Connor says that Mission Health offers the latest in minimally invasive repair options for even the most complex hernias.
The best way to repair these defects in the abdominal wall is by separating the layers of the abdominal wall, bringing all those layers back together in layers, and then reinforcing the abdominal wall with a piece of mesh. Now we're able to do all that dissection and all that reconstruction using the surgical robot, and that reduces pain substantially. And we've taken a surgery that used to be a 3 to 5 day stay in the hospital, and now it's an outpatient operation. Patients go home the same day from their operation. The techniques that we're talking about really have only come out in the last 3 to 5 years. So this is brand new, cutting edge stuff, and really impressive to have that available to patients here in Western North Carolina, right close to home.
To learn more, go to missionhealth.org/healthbreak.